Hi. I think one of the most major concern for every patient and the family is how safe is bariatric surgery. And they are more focused on the technical side of the surgery. While I believe that it's not only a question of how I do a surgery on a particular day, but it's the entire environment built around a bariatric program, which should be verified to make sure that the surgery is safe. So how does it happen? When you come in my consulting room to discuss about surgery, I'm trying to find out in that half an hour or 40 minutes, what is your lifestyle? What kind of a person you are? Are you a vegetarian, non-vegetarian? Do you smoke? Do you drink alcohol? Do you take your medicines regularly, whether it's for diabetes or tuberculosis or whatever, the blood pressure, whatever? Do you take them regularly? Do you do you uh, do you eat out very frequently? Then based on your age and other factors like other diseases like diabetes, blood pressure, or sleep apnea, I'm trying to decide a surgery which is suitable to you. So the idea is to individualize the surgery. And that is an important component of safety because I don't want to give a malabsorptive surgery which causes malabsorption of food items to somebody who is not very good with protein intake, who is not very good with medicine intake, because these people will require high protein diet and vitamin intake after surgery for a long time. So I think the most important component of safety of surgery starts in the first consultation, when as a surgeon, I take a call on which surgery should be ideal for you. Then comes the second part, which makes this any surgery safe, is how do I prepare you? So preparation of a surgery includes different types of tests to assess your lung function, kidney function, heart function, and everything else. Now, many patients says, but these are not required. I am just 28-year-old, and why do I need to undergo all this? Please realize that this is all in the interest of making sure that nothing goes wrong during surgery. We also try to avoid unnecessary interventions. Like in my program, we don't advise patients on liquid diet, very rarely, while there is a guideline that liquid diet should be given for 2 weeks. I believe, based on the evidence that we have published also, that this is not required and does not help the patient at all. So I don't believe in torturing a patient just because there is a guideline to that extent. So we avoid situations, but then we also ask for endoscopy for every patient, maybe manometry if patient is asking for a sleeve gastrectomy. And all these endoscopies and manometries are done under anesthesia. We don't do anything under local anesthesia. So making you comfortable is also part of safety. So doing endoscopies under anesthesia makes sure that you tolerate the procedure well. And then in these visits and preparation time, we also counsel you. Our counselors talk to you, dietitian talks to you to prepare you for what is coming after surgery, how easy it is to manage yourself. It's not really difficult at all. Then the next stage comes, and that also is an important component of safety, is when we start discussing which hospital you should undergo surgery. Now, please realize that this discussion is happening based on the merits, on your fitness. So if somebody has, let's say, a kidney disease, I would like to operate in a hospital where dialysis facility is there. 99% of time, dialysis may not be needed, but if it is needed, we must have the backup available on that day. Similarly, somebody who has a stent in his heart, or somebody who is a blood pressure patient for a long time, I'll rather do it in a place where we have a cath lab available, or ICU available, or a full-time cardiologist available. Now, all these things happen in a subconscious mind while I am talking to the patient. I am trying to evaluate where should I do it, how should I do it, and which place will be safe for you. And this is all done before surgery starts. Then there is another decision. A lot of patients come because their child or the young person is just in 20s or early 30s, and they are looking for a surgery which is popularized that you can do it with a single port, single cut instead of 3 other small cuts. Now, we have been doing these single port surgeries, but there are certain reasons why we do not actively encourage it. And the main reason is that when 4 instruments go through a single cut, they do not reach so comfortably in that area where they are supposed to do the most difficult part of the surgery. So vision is limited, accessibility is limited, and though both the things make surgery comparatively less safe than a standard laparoscopic surgery. Because in a standard laparoscopic surgery, the instruments go from different areas and they directly reach the area where surgery is to be done. Then, as far as cosmesis is concerned, if somebody is saying that, okay, single hole will not look bad later, now we are able to do these laparoscopic surgeries with mini lap instruments, which are like 3 to 5 millimeter in size in a cut. We don't need to put even glue, stitch on that. And the additional advantage is that when we do with a single cut, the cut is about 3 centimeter big. While when we do it with mini lap, the cut is only 3 millimeter. Now you realize the difference. A 3 centimeter cut puts somebody at a higher risk of developing hernia later, while a 3 millimeter cut, hernias cannot happen. So in long run, a mini lap or a traditional laparoscopic surgery is definitely better than the single cut, and it's equally good as far as cosmetics is concerned. Then during surgery, I routinely oversew the staple line and put omentum in an area where there is a possibility of staples not holding or a leak, as we discussed. And since we are doing it in last 7 years, we have not had a single patient who had a leak. So we have been able to avoid the most difficult complication of bariatric surgery by doing some extra steps. And this is more so because most of these patients, almost 40% of patients, are traveling from outstation to Mumbai, and we don't want them to end up with a problem once they go back. Additionally, we close all the mesenteric defects. So in any bypass surgery, generally there is 1 or 2 defects which get created because we are moving the intestine from a normal position to the stomach. Now, this is a technically challenging step. And in many centers, it is possible that they are not closing it for various reasons. But what happens if this defect is not closed? There is always a possibility of internal hernia. And we have managed these internal hernias for various centers across the world when patients end up with an internal hernia. So I think closing this mesenteric defect, which takes hardly 5 to 10 minutes extra, gives added security to the patient and reduces long-term complications. Besides this, we take pride in saying that we take every possible step to avoid a blood clot formed in your legs, which will move to the lungs. So pulmonary embolism is avoided by whatever is required in terms of blood thinners, pumps, stockings, and many other things. We also follow ERAS protocol, which is Enhanced Recovery Protocol. That means patient is allowed to have water till 4 hours before surgery. Patient is allowed to have water again after 4 or 5 hours after surgery. Patient is made to walk by evening. Patient can, generally we avoid putting catheters, tubes, drains if they are not required in most of the patients. And that helps in early mobilization. And if the patient is able to walk early, half of the problems related to bariatric surgery can be avoided. Now, it's not only a question of what we do during surgery. The important thing is what happens after surgery. So majority of the patient, 99% of the patients, because they are prepared well, do not require ICU. They directly go to the room. So their recovery is better, they're psychologically better because they are with their loved ones. And then they are started on a portion control diet on day one. So they are allowed to have sips on day one. And this portion control diet helps them avoid complications of surgery like leak, helps them avoid vomitings, helps them lose substantially more weight in first year, and helps them maintain weight in long run. And again, this on portion control, we have done our publications. If you, any one of you want any of the details of our publications, they can go on our website and check it, or you can communicate with us and we can share them with you. Last and probably the most important of all this is the follow-up by team and our accessibility. Now, when somebody undergoes surgery, we make sure that they get phone numbers and email IDs of entire team, including my phone number, cell number, and we are so easily accessible. And that is not a matter of communication, that's a matter of safety. Because if you have something, an emergency anywhere in the world at any given time, you know that your surgeon and your surgical team is just a call away. Otherwise, we are reachable on the phones, on WhatsApps. And as I said, that majority of our patients are from outstation. Most of them have direct access in terms of communication. So even if they can't travel back to India or from other city to Mumbai, they are able to send their reports and our team can analyze, and we can set up a consultation, audio or video consultation for these for this situation. So I think safety is not a matter of surgical technique. Of course, it's a matter of surgical technique and experience of a surgeon, but it is a carefully curated ethos of a team, of a program, where you as a patient is in the center of all the activities. As long as we are thinking of your interest and making sure that you are comfortable, you are safe, and you are back home with your relatives early, that is what the success of a program. So friends, let me reassure you, there is enough published data now which says that bariatric surgery is as safe as a gallbladder surgery or a hernia surgery. They are entirely different in the grade of surgery, but the surgical outcomes are equally good as a hernia surgery. And as many of patients do not hesitate to get a hernia done, I think where it is required, do not hesitate to get it done, because this is not, surgery is not a question of last option. It is probably the only option for patients who require this surgery.